Welcome to Beyond the Breakwater, where just beyond the crashing waves of fear, discomfort, and doubt lies the greatest potential for life transformation. We want to guide you into the open waters where the calculated risk you take becomes the turning point for you or your organization to thrive. So draw up your anchors and prepare for departure in this week's episode of Beyond the Breakwater. Welcome back to another episode of Beyond the Breakwater. I am Lyndsay, and today with me is Ed and our practice manager of Gateway, Jen Purifoy. Welcome. Hi. Did I say that right, Jen Purifoy?
You did.
Okay, thank goodness. I should have clarified before, but I'm glad. So Jen, last week we had Jim on. He is kind of your counterpart. He's the clinic director of Gateway. You have been there now for how long?
Oh my goodness. So September, this is what, May. So that's 9 months almost.
Yeah. We're dating ourselves a little bit because I don't think our listeners will hear this for a little bit, but you've been here for 9 months. And we kind of just want to give an idea to listeners, like your background, why you're here, how you came to this point. They should have a little bit of an understanding of what Gateway Healthcare is. But I think just on the principle of, okay, if we have a first-time listener here today, Jen, could you summarize what is Gateway Healthcare?
So Gateway Healthcare is a nonprofit healthcare organization. We are family practice. We are urgent care. The premise is we do treat anybody. I jokingly but truthfully say if you have breath in your lungs, we will see you. But we really want to make healthcare affordable for those that cannot afford it. And unfortunately, healthcare is really unaffordable. So if you are within the 300% of the federal poverty limit, your healthcare services are going to be no more than $40 with us. And that's going to include everything, labs, point of care testing like strep screens and so on.
So what kind of an income does it take to be within 300% of poverty level?
For one person, it's $44,000. For a family of two, it's $59,000 and up from there.
And what's included in that doctor's visit if you qualify as a patient? You're paying $40, and what do you get for
So
that?
you're going to get, obviously, you're going to see the provider, and then that's going to include whatever labs, whatever testing you need. So it could be a strep screen if you have a sore throat. Could be testing your urine if you're having some urinary issues. It's going to be referrals. It's going to be what we call wraparound care. So we're going to address other issues that you may have if you're having transportation issues, food insecurities. We partner with other community partners that meet the needs of our population. His Hands Auto will send you over there. There's a dental clinic in the plaza that we're in that treat the same population. We'll send you up there for a referral, and we also partner with My Michigan Hospital because if you qualify with us, you qualify for them. We partner very deeply with them to send you to their specialists for x-rays, for labs with them, CAT scans, whatever needs that we might not be able to meet. We'll send you over to them.
Anything that can't be done at Gateway, you can refer them to then the hospital. And all they pay is the $40 for Gateway because they are qualifying for the financial program at the hospital as well.
That is correct. And we will print off the patient assistance application and help the patients fill that paperwork out.
Awesome. And I think all of this is to say, like, people hear this and they're like, okay, but where's the catch? Like, this is too good to be true. Healthcare is confusing in general. Like, I normally don't ever go to the doctor because it's just confusing. And I'm like, okay, even if it's covered by insurance, there's no way it possibly could be. There's always all of these hidden fees. But with Gateway, like, that's not the case. There's no catch. You guys walk people through the system so they know exactly what to expect. If there's something else going on in their life, like you said, you'll refer them. And all of this is made possible by donors as well. So we talked about this in the podcast with Jim, where a donor will pay $35 so that the patient pays $40, making up a $75 doctor's visit. So if people are wondering, like, how is that even possible that you guys are doing it? Like, the answer is donors. So Jen, I want to kind of get into your story because it's always fascinating how people get into the ministry that they're overseeing. I've said this before on the podcast, but people ask, like, okay, we want as a church to do these ministries. Like, this is really exciting, but we don't have the people. We don't have the staff. Where do you find Jen? Where do you find Jim? Where do you even come from? And you came from applying to our Kids Creek Early Care and Education program, right?
Well, I personally didn't apply. A certain web-based application site, we will say, applied on my behalf. So
That's called the Lord.
that is called the Lord. I was just going to say that. So God has a way of working things out. And most of the time in my life, I've noticed that he will do things and I'll be like, oh, okay, this is what we're doing now. And so, yeah, God applied for me, and it just so happened the previous position, it was a corporate position, and I was looking to make a change anyway, and nothing. I was throwing things at the wall, and it wasn't sticking, and Gateway happened. So, and
So
it
what was Ed?
amazing.
You're kind of the employer in this aspect. Like, what was it on your end when you guys saw Jen's application come in?
If I take you back just 24 hours before that, Jim and I had met, and Jim was crying because he said, we need somebody. The clinic is doing amazing, and I think Jim has done a stellar job of running it. I mean, the providers, they get the credit. I mean, they're doing the healthcare part of it. This is really the administrative side of it. And Jim met with me, and he just said, we need to bring somebody in. And we were like, how are we going to find somebody? And I said, well, why don't we just take some time right now and just pray for a miracle? So we prayed for a miracle. And I believe it was that afternoon that Christine called Jim and said, I have this application that came through the early care and education, and it's for somebody who's got a lot of experience in healthcare. And so Jim didn't even have your phone number. We didn't have it on the application because you didn't send it. And so he actually searched everywhere to try to find a number for you and called 3 numbers, and they were all bad numbers, and called the 4th number, and that's how I got a hold of John. And so this was Wednesday when Jim and I prayed, and Thursday you interviewed with Jim. I came in on Friday and met you on Friday, and we already were working on a package. So it was it was a cry of desperation to the Lord.
And Jen, do you remember that phone call? Like, what was that like for you?
It was amazing. I mean, it was an answer to my prayers as well, because like I said, I had been wanting to get out sometime from where I was at, and nothing was happening, so I kind of gave up, and I was assuming that's where I was meant to be, and I interviewed on day 1. Day 2 with that, I was like, when can I start?
Yeah.
And it was the best decision I've ever made. I don't ever want to be anywhere else than where I'm at right now. It literally is everything to me. I was just telling Jim the other day, God first, and the ministry is beneath that, and then everything else in my life falls in line.
Jen, everybody has a story. Why did you get into healthcare?
Again, it was one of those things that God directed my feet. I was not in a good place in my life. I had made a slew of really bad decisions, and I needed to make a change. And I've always been Alice. I've always been in poverty myself, and I didn't have anything going for me. So I enrolled into school to become a medical assistant so I could better myself. And I graduated with my certificate in 2003 and got my very first job making $8 an hour. And the state of Michigan said, well, because you make $8 an hour, you and your husband as adults no longer qualify for Medicaid. And we lost our insurance. Wow. And from 2003 until almost 2016, we were without insurance. And being Alice, I lived the struggle, had to find resources myself, and had to navigate the system and try and figure out, where am I getting food, and how am I paying my rent, and how am I fixing my car. And as Lyndsay said on the podcast with Jim, yeah, I've had to turn up the radio because I couldn't afford to fix that sound. So I've been there. And even now today, I'm still Alice, and that's okay. I never want to be anything but Alice. And the reason for that being is I will take the hard so other people don't have to. That is everything to me. I don't want people to have to struggle, so I will struggle.
What was that like when you lost Medicaid? And here's what I'm asking. I want you to personalize it, Because it's my understanding, just in the state of Michigan this last year, 400,000 people, over 400,000 people, just lost their Medicaid insurance. So I'm wondering if you can take me back to that. What did it feel like when you lost your insurance? So speak on not just your behalf, but the 400,000 that just lost their insurance.
When you are going to work every day and you're working hard and you're trying to support a family, and at the time, my boys are grown now, but we had 2 small children at home, and you're trying to put food on the table and you're trying to pay rent and you're just trying to scrape by. And the state says you are working so hard and you're paying your taxes and you're being a productive member of society, which I wasn't prior to this, honestly speaking. But you're doing so well now and you're working so hard, but you don't deserve to be able to have health care. You don't deserve to be healthy. And it's discouraging and it is defeating and you feel almost like giving up. And then when you can't afford to pay for medicines and you can't afford to pay for doctor's visits, and there are times when you can't afford to buy a gallon of milk and you're getting creative with meals. I mean, honestly speaking, I remember one meal that I made for me and my boys. This was before my husband and I got married. We literally had a pound of hamburger, a potato, an onion, and steak sauce. And that was soup for a week. Society looks down on you when you're living like that. And you have no dignity. You have very little self-respect. And then when you're trying so hard to go out there and work, and the government is telling you, you still don't deserve to be healthy, you know, it's discouraging and it's defeating, and you don't feel like getting up anymore because why bother?
I think that's an interesting thing when you say it's discouraging. Was it ever frightening? I mean, because now you've got a family, you've got young children, you have no insurance. Is there fear in this at all of what happens if?
At that moment, I can't say there was fear. It was just kind of, you're so, if you've ever been in a batting cage and you've had all these softballs being just thrown at you, and all you can do is just try and deflect them left and right, that's what it felt like. So I didn't have a moment to feel fear because I was too busy trying to deflect what life was throwing at me. Fear would come later on.
So you were in a position of you couldn't afford health insurance. And I think that was even before, say, we had Obamacare.
That is correct.
And so you didn't really have a place that you can go to get affordable insurance.
Nope.
But it was taking away the insurance that you had. So you were in this place that many, many people are finding themselves in today in the workplace. And it sounds like a really bad place to be.
It was horrible. It was absolutely horrible. And, you know, that was a moment in life where it wasn't the car per se, but all you could do is turn up the radio and ignore the sound.
Yeah.
That's all we could do.
And you were working at this point too, right?
Oh, yeah. I was working 40 to 50 hours a week. And there came a certain point in time where, you know, I took on a second job and, you know, I was working 7 days a week and 14 hours a day.
Wow.
You mentioned you were trying to better yourself.
Yes.
And I think that's what's really interesting about the system that we have now, which we're going to get into talking about the system and the broken system. So here you were trying to better yourself, but you were almost being punished for trying harder. And so now you're making some money and now you lose your health insurance. So now you're at risk and your family's at risk. So now you have to work even more and more and more and more. But still, even though you were working, you said 7 days a week, let's just say those 14 hours a day, but it didn't include insurance.
Nope.
So you were still on your own if you had to go to a doctor.
Yep, absolutely.
So do you remember those days, Jen, like when somebody was sick in your family, whether you or somebody else, what did you do?
Absolutely nothing. There wasn't anything that could be done. You know, you went to the local pharmacy and got over-the-counter remedies and, you know, called my granny and said, what would you have done back in 1948 to treat this? You know, and tried the holistic methods, tried the over-the-counter methods, and prayed for the best. That's all we could do.
Did you ever find that it wasn't enough? Like you
All the
tried
time.
everything and it wasn't enough?
All the time.
So then what did What did you do?
There were times, I mean, honestly, my credit was absolutely in the hole because, at a certain point in time, certain things got to a point where you don't have a choice but to use the emergency room.
Okay.
And you can't pay that $2,000 and $3,000 and $4,000 bill because you don't have the money. So you go into the emergency room, that goes on your credit. Now they're garnishing your wages. So the money that you really didn't have from the get-go, now you have even less of.
So now it just makes everything harder because health is one of those things that we all want. I mean, everybody wants to have good health. I don't think there's anybody who says, oh, I hope I have bad health. So, I mean, we want to have good health, but we're in a system that's like almost working against us. So from the outside, I know I'm a little bit more learning a lot, but from the outside, it seems like if you have wealth or you have money and you have insurance, then you're in pretty good shape in terms of getting the health care that you need.
Sometimes.
Yeah, I'm sure there's a lot of limitations, and you shared some of those with me yesterday. But if you're on the other spectrum and you have Medicaid insurance, so which is a great thing, so now that you're on the provider's side of this as the practice manager, not everybody who has Medicaid is always welcome in clinics. Is that a fair statement?
That is 100% a fair statement.
Can you maybe explain the why? Because there's thousands, hundreds of thousands of people on Medicaid insurance, so they have it. But what's the downside of that?
Well, Medicaid, number one, does not reimburse providers at a very high rate. On average, it is estimated that in order for a provider to break even off of a Medicaid patient, they can only spend 7 minutes, as noted in the podcast with Jim. 7 minutes with that patient. Well, you can't get anything done in 7 minutes. I mean, It would take me longer to walk out this door into my car than 7 minutes.
Yeah.
And a lot of Medicaid patients have many issues. They need many referrals. A person doesn't just get to go on Medicaid, and it takes months to go on Medicaid. A lot of times their health has been neglected before they go on Medicaid, before they ever get to be able to receive that insurance. So now they have a host of problems that need to be addressed. And because the reimbursement rate for providers is so low, a lot of providers don't accept that insurance. They will only accept a certain amount of Medicaid patients. So a lot of them are left in the weeds.
Question. I'm playing the resident confused person here because I am always. But so Medicaid, normally like insurance would pay the provider, but Medicaid doctors do not get any reimbursement for that. So it's just like free work they're doing?
They get some reimbursement.
Okay, but it's very minimal?
It is minimal. So, and all insurances have what they call an allowed amount. So just because our office might charge $75 for an office visit, based on the contract, the insurance is only going to pay a certain amount of that. So one insurance might give you $60 of that. Another insurance might only give you $30.
Okay, so those are more commercial insurances. But let's go back to Medicaid. I think it might help people to know maybe just a little bit of data. Like, it costs our clinic approximately $153 an hour to run. So if we have a Medicaid person with Medicaid insurance come in, typically how long do we spend with somebody who has Medicaid? Like, how much time does our provider spend?
It could easily be an hour.
Okay, so we spend an hour with them. Our cost is $153. And what would be the reimbursement that we get from Medicaid for that hour visit?
It really is dependent on the type of plan because each Medicaid plan does reimburse differently. But
Can you give an
realistically, we may only see between $30 to $50 of that.
Okay, so $30 to $50 per visit, but it's costing us $153 an hour. So I think everybody could see, whoa, clinics really can't survive on that.
No.
And we have kind of a bare bone, staff. I mean, we have a lot of volunteers at Gateway, so that makes it, I think if everybody was paid at Gateway, that would be a whole lot more than $153 an hour. So we have people like just in all capacities that are volunteering. So if that's what Medicaid is paying, you could see how a provider, it's just logical, a provider can't have very many Medicaid patients. So when they come into our clinic, when they come into Gateway, and you have Medicaid insurance, how are they treated?
If they are treated just like a billionaire would be treated. I mean, they deserve the same amount of dignity and validation and love that everybody else does. I mean, they're going to come in, we see you, we understand you. I have been you and I always will be you.
So we don't limit it to 7 minutes.
No.
We give them the time necessary. You mentioned referrals. I'm not sure everybody understands what that means. So if somebody comes in and they're having, I don't know, some kind of an issue, and it's more than Gateway's able to treat, what do you mean by referral?
So they might need to go see a doctor who specializes in something. Maybe they'll need somebody who specializes in a heart. That is a referral. We'll make an appointment, call a specialist, and refer them over. So that's a referral. Or they might need a CAT scan. That's a referral. So they might need services beyond what we can provide for testing or specialists.
So you had mentioned before that you had a patient that had 7 referrals just recently.
Mm-hmm.
That's a lot of referrals. That
is.
says that there's been a lot of issues in that person's life, and you needed more than 7 minutes to even find out what those issues are, so that you could refer them to the hospital. And I just want to give a shout out for our local hospital, because they have been amazing. That all the people that we've been referring to them under their financial aid plan.
Yes.
I think you and Jim have shared with me that they have not charged our patients anything. So they're getting the best health care they can because they're coming to us. So if you come in uninsured and it's you get great care, and then we refer to the hospital, you're continuing to get amazing care, but it's not costing them any more than $40. And I think that's where people say there's got to be a catch.
Nope.
You know, how can you have the best health care for a $40 fee? And that's what it really is. You've talked about it's kind of a broken system. Maybe we can unpack this just a little bit on what does that mean. You've shared with me, there's from the provider standpoint, there's from the hospital standpoint, there's from even the insurance company. So where do you want to start? As you're in the system, where do you see it when you say broken? What does that mean?
Oh, it is. And it's broken as if somebody dropped a piece of china on the floor. It's shattered into so many pieces. So let's start with the insurance piece.
Okay.
Let's discuss how broken it is from the insurance standpoint.
Okay.
So do you wanna lead or?
Well, that's okay. Let's just go into the insurance a little bit, because I think there's an understanding that when you have insurance, I mean, employers or individuals are paying into insurance. Now, there's an automatic flaw in the insurance system because they are collecting money, but they really don't want to pay out money. That's how they make a profit.
That is correct.
So there's a flaw right there. Like, okay, we're paying all this money for insurance, but they really don't want to pay it out. So when you go to the doctor and it gets applied or it gets charged to the insurance company, walk us through what happens.
So, you go to the doctor and we bill the insurance company, and more often than not, the patients have their premiums that they pay every month, but then they have things called deductibles and out-of-pocket maximums, which means the insurance is not going to pay a dime for your services until you pay additional amounts of money out of pocket. So, for example, your out-of-pocket maximum might be $7,000, which means on top of your monthly premiums that you pay every month, you have to pay $7,000 out of pocket before the insurance is going to pay a dime.
So I know a little bit of data, like for a family of 4, insurance plans are about $17,000.
Wow.
And the deductible for a family is $18,200. So what you're saying is that if the employer or the employer and the employee are sharing the cost, they have to hit that $17,000 for the plan. Then they're going to have to hit another $18,000 for the family before insurance companies want to pay something out.
Exactly. And that
So-
$18,000 is not shared between the employer and the employee. That is just the employee.
Okay, so that seems to me like even if you have insurance, so let's maybe talk about people that they have insurance, but maybe they're Alice and they have insurance, but now they can't afford a $5,000 bill. And they said, but I have insurance. And now they're getting a bill. Have you faced some of that with some of the patients?
All the time. And for the record, that is what we call underinsured. So you have
Okay.
uninsured, and that is what we refer to as underinsured. They would be treated just like our self-pay qualified that we talked about just a few moments ago. So if you're qualified and you have insurance, that same $40 principle that gets you everything that we talked about, no, there are still no catches, applies to that underinsured ALIS patient as well.
So for a family of four, that's $90,000 is the rate that we use. I mean, that's the threshold. So if you're a family of four making less than $90,000 and you have insurance, they would pay $40 for that visit.
That is correct.
So, Lyndsay, you have talked in the past about you interviewed a couple of people and they didn't have insurance. And do you remember in the interview, like, how did they feel when they walked into a doctor's office and didn't have insurance?
I mean, I think they said that they just felt like it wasn't for them. Like they were looked down on. But it was like the reason they didn't have insurance was they turned 26. They fell off their parents' insurance. Both of them are working jobs that were like multiple jobs, or they were at one that they were working like 50 hours a week. Another was doing photography as a part-time gig, trying to make it full-time while also working a couple other side jobs. So it's like with all of these jobs combined, they're not offered health insurance. And so that was just the situation they were in, where they're like, they walk into a normal doctor and they're looked down on. And then they said when they came to Gateway and they kind of like had to swallow their pride and be like, I don't have insurance. And someone was like, well, you're exactly who we're here for. And they were like, what? You're here for me? Like, you actually want me here?
When you think about, we're talking about a lot of people.
Yeah.
I know in the state of Michigan, about 39% are ALIS and below. And again, we're using the threshold of 90,000, not 72,000, which is what we use for ALIS. So 1 or 4 out of 10 people are going to walk into a doctor's office and either have no insurance or have insurance and can't afford the deductible, and now they're panicking because they can't afford it, or they have Medicaid, and if doctors aren't really taking a whole lot of Medicaid, that's a huge segment of the population that we're really, I don't want to use this or refer to it, but they may not really be welcome to go into places in the doctor's office that they can't pay for. Is that a fair statement?
100%.
So you've experienced this. How do people feel when they walk into the doctor's office? You said embarrassment. How do you think people are feeling when they go to a doctor's office or wind up in the hospital?
Oh, from experience, I can tell you it's shame. It's embarrassment. It's, here we go again. Here's somebody else who's going to look down on me. Here we go again. Somebody who's going to think that I'm not a productive member of society. There's so much stigma and assumptions with that. And I want to add a piece about the Medicaid. You mentioned Medicaid patients. Little fact that will blow your mind a bit. Technically Medicaid requires their patients pay a $5 copay. Do you know how many homeless people are out there that are on Medicaid that go to the doctor and are expected to pay $5 out of their pocket?
Okay, well, I don't want to leave this hopeless because that could be hopeless if you don't have $5. Because I know we've treated patients for having as little as $1
Yeah, we do.
when they walk in. And that's all that person had to their name. And we
That's
collected
okay.
$1 and gave them the best health care possible.
And we always will.
So Gateway's different because when a person walks in, I mean, with everything we just talked about, dignity is one of our values, huge value.
Yes.
So what does dignity look like when a person comes in to Gateway?
Dignity is treating that patient, that ALIS patient, that Medicaid patient, that homeless patient, that patient who feels marginalized everywhere else, as if they were Steve Jobs or Jeff Bezos. They walk in and they are a billionaire to us. They are literally every person everywhere else. They deserve all the validity, all the love, all the respect in the world. Why? Because they are a human and they are of God, and God does not make junk.
So it's kind of a special place where it doesn't matter how much you make. It doesn't matter what your insurance is. It doesn't matter if you have it or not have it. dignity is one of our values that we practice. We don't just talk about it. It's not a value on the wall. In fact, you won't see that value anywhere on the wall.
No.
But it's just how we treat people.
Dignity is the top value.
That's incredible. So then they come in, they get treated like royalty, and it doesn't matter who they are. And it sounds like the services that we're able to do are pretty amazing.
Yes.
Okay, so let's go back to insurance. So you've struggled.
Yes.
That's a good word to say. I know there's probably other terms that you can all use about dealing with insurance companies. Why is it so hard?
Personally or professionally speaking?
How about professionally from a clinic?
Okay, so professionally speaking, why it's so difficult dealing with insurances. Number one, people don't understand insurances. Honestly, other facilities don't understand insurances, and insurances don't understand insurances. It is convoluted, especially when you're dealing with people who have multiple insurances, trying to figure out who pays first. Nobody wants to pay. Trying to get them to pay, you have to do things, what they call prior authorizations a lot of times. So, if I need to refer Lyndsay to a certain service, her insurance might say, well, you have to get authorization for that medication or authorization for that service, which is special permission. And I am sending the insurance company a flood of documentation, and the insurance company might still come back and say, yeah, we're still not paying for it. We're not going to approve that. But I know she needs that testing. She needs that special service. So they don't want to pay, and that probably is the biggest issue.
So if you had to summarize it, the biggest issue is you just feel like insurance companies really don't want to pay.
That is correct.
So even though employers are forking out a lot of money, $17,000 a year for a policy for a family of four, but the very insurance companies that you have insurance with don't necessarily want to pay out.
That is correct. Actually, it's been about 15 years, but there was an insurance company that was brought under fire because a lady was into an accident. And this was not in the state of Michigan, but she was in an accident, required ambulance transport to the hospital because the accident was that bad, rather. And the insurance company denied payment for the ambulance ride because she did not obtain prior authorization first.
Wow.
I watched this documentary once, and it was talking about, it interviewed a bunch of people about their stories with insurance companies. And this woman had a condition, like it was like brain cancer or like breast cancer, like a type of cancer. And the insurance company hires like hitmen, and they like go and search all of your records to try to find anything, any type of pre-existing condition that would be grounds to deny you coverage for whatever you're getting done. And so she had like a yeast infection years and years and years ago that she had not listed as like a pre-existing condition. And so that hitman was hired to find that, found it, and then she was denied coverage for getting this like procedure done for a brain tumor, where she was like, I didn't think I had to list that as something that was, a pre-existing condition. But it's like, that's the level that I think insurance companies like don't want to pay for anything.
Absolutely. Now, the good news is the Affordable Care Act has done away with pre-existing condition clause.
That's a good thing. So I'm kind of new in this arena, just having been a part of it for 2 years now. I think the thing that surprised me the most, and maybe you can comment on this, but let's not be too harsh, it seems to be kind of money driven, especially with insurance companies.
Yes. Absolutely.
Would you agree with that?
100% it is. Healthcare in general has went to more about profitability from a business standpoint than the humanity people aspect.
I think that's the biggest surprise for probably people, because I think we all want to believe that it's all about healthcare and it's all about getting the best healthcare. And so when we're going into a doctor's office and you think it's really about getting great health care, only to find that it's really a lot more about money and using healthcare as a means for profitability, there seems to be something not quite right with that.
I agree. I think that's a large part of the society in general that we live in, but we can actually see that as evidence to how we discussed that how providers do not want to see a lot of the Medicaid patients because it's just not profitable. If there was more of a humanity healthcare aspect, the profitability would not be as big of a piece to that. We can see that in the fact that a large majority of the hospital systems in the United States are absorbing family practices because family practices are very expensive to run. The reimbursement rate for services just is not very high like it is with specialist services. So hospitals are absorbing the family practices because the costs get offset by the specialist services that those hospitals offer. That's how they're profitable.
Okay, so we're kind of heading into kind of the hospital scene. And again, I want to speak really well because we have an amazing hospital.
100%.
But when hospitals seem to be like absorbing all of these doctors' office, do you think that's driven financially? Is it from the hospital side wanting those practices to close down, or do you think it's becoming extremely expensive for doctors' offices to stay in business because it's staying in business? Mm-hmm. That's what they're there to do. They're earning a living, and it's not worth it for them. So which would you say is more real?
I think it's more of a partnership. Family practice providers need to stay in business. People need family practice providers. It's not profitable. And these providers need to make money, especially when they have student loans. So the only way for them to remain profitable is to be partner with or be absorbed by a hospital system. So I really don't think it's, greed per se, but, they do have to keep the lights on. They're not, operated by donations such as we are. They do want to be profitable. A lot of them do anticipate making money, and that's the only way that they can do so. That's the best option in their mind. Now, with that being said, I'm going to take a pause and give a shout out to our hospital because they have absorbed practices in our area, but because of the need for family practice is so great, they actually refer a lot of patients to our clinic because they just can't get them into their practices in a timely fashion. So they do send them over to us. So big shout out to our local hospital. They're amazing to partner with.
That's really cool when you think about the hospital is partnering with us. And that was not always that way.
No.
But it seems like the reputation of Gateway is such that the hospital trusts us with the patients that are coming to them to do follow-up care and care for the patients that they started the care, and then we get to continue that care.
It's amazing.
Well, Jen, I know we're kind of getting it wrapping up, and there's so much more to talk about. I can't wait till next week because I want to continue the conversation. Lyndsay, anything to share as we kind of wrap this session up?
I don't think so. I mean, it's just been an enjoyable conversation. I think there's still a lot more to cover. There's still a lot of like what Gateway can provide, like what happens if Gateway were to close or not exist, like what are all of the people that we're serving, like what are their solutions? I think you have a really great personal testimony as to why you are involved in Gateway and why you care so much about patients receiving the care that they deserve and have a right to. And that's a story that I would just encourage listeners, like, come back next week, because hearing that and hearing your heart, like, that's what all of this is, why you're here and why you do what you do and why you do it so well. So Jen, thank you for being on this week. Thank you for what you do, and we will see everybody next week. Thanks for tuning in to this week's episode of Beyond the Breakwater, a podcast of Elevate Community Ministries. Don't let the conversation stop here. You can email us at hello@beyondthebreakwater.org. We would love to chat with you, answer questions, plan a visit, and help you take your next step. We'll see you next week.